Ever wondered what causes that big painful bump on your face known as cystic acne? Acne is an incredibly common skin condition, and it comes in many forms. Let's unpack it. At its core, acne is a disorder that occurs when hair follicles become clogged with oil and dead skin cells. Now there are 4 main types of acne we'll be discussing today: cystic acne, blackheads, Milia, and whiteheads. Cystic acne is the most severe form. It's characterized by large red and painful breakouts deep in your skin. On the other hand, blackheads are small bumps that appear on your skin due to clogged hair follicles. Then we have Milia, tiny white bumps that usually appear on the face. And lastly, whiteheads, which are a type of acne that forms when dead skin cells, oil and bacteria become trapped within one of your pores. They all share common causes but have specific triggers and treatments. Stay tuned as we delve into what causes these pesky skin issues and how you can combat them. First up, let's tackle the big one: cystic acne. Cystic acne is the most severe type of acne, characterized by deep, inflamed breakouts that lead to painful, large cysts under the skin. It's not your average pimple, folks. So, what causes this skin villain? The primary culprits are hormonal changes and clogged pores. Hormonal fluctuations, especially during puberty, pregnancy, or periods, can lead to an increase in oil production. This excess oil, along with dead skin cells, can get trapped in the pores, creating the perfect environment for bacteria to thrive and form a pimple. But in the case of cystic acne, the infection goes deeper into the skin, resulting in a painful cyst. Now let's touch on treatment options, because no one wants to live with painful cysts. Over-the-counter products containing salicylic acid or benzoyl peroxide can help reduce inflammation and clear clogged pores. However, these might not be enough for severe cases. Prescription medications could be the next step. Topical retinoids can help by speeding up the rate at which skin cells turn over and die, preventing clogged pores. Oral antibiotics may also be prescribed to reduce bacteria and fight inflammation. In some cases, birth control pills or hormone therapy can be an effective treatment for women and adolescent girls, as they can help regulate hormonal imbalances that may contribute to cystic acne. Lastly, it's worth noting that isotretinoin, a powerful medication used for severe acne, can be an option. But it's not for everyone due to its potential severe side effects and should only be taken under the supervision of a dermatologist. While cystic acne can be painful and frustrating, understanding its causes can help you manage it effectively. Remember, everyone's skin is unique and responds differently to treatments, so it's crucial to consult with a dermatologist to find the best treatment plan for you. Moving on, let's demystify blackheads. Blackheads, as their name suggests, are small, dark spots on the skin, often found on the face, but they can also appear on the back, chest, neck, arms, and shoulders. They are a mild form of acne and are caused by blocked hair follicles. But what exactly blocks these follicles? 2 primary culprits are excess oil and dead skin cells. Our skin naturally produces oil, also known as sebum, to keep it hydrated and healthy. However, when too much oil is produced, it can mix with dead skin cells and form a plug in the pore. This plug, or comedo, when exposed to air, oxidizes and turns black, thus forming a blackhead. Now you might be thinking, how do I get rid of these pesky blackheads? Well, there are various treatment options available. One popular method is using pore strips. These adhesive strips are applied to the skin and then peeled off, pulling out the blackheads. But remember, pore strips only provide temporary relief and do not prevent new blackheads from forming. For a more long-term solution, you might want to consider over-the-counter products that contain salicylic acid. Salicylic acid is a beta-hydroxy acid that helps dissolve the excess oil and dead skin cells that cause blackheads. Regular use of salicylic acid can help keep your pores clear and prevent blackheads from forming. Another option is to seek professional help from a dermatologist. They can perform procedures like microdermabrasion or chemical peels, which can help treat and prevent blackheads. Remember, everyone's skin is different, and what works for one person might not work for another. It's always a good idea to consult with a dermatologist before starting any new skincare routine. Blackheads might be stubborn, but with the right treatment, you can keep them at bay. Next up, we have 2 lesser-known but equally annoying types of acne: Milia and whiteheads. Let's start with Milia, those tiny, pesky white bumps that usually appear around the eyes, cheeks, and forehead. They might look like whiteheads, but they're not. Milia are small cysts filled with a protein called keratin, which gives structure to our skin and hair. Unlike whiteheads, which occur when a pore becomes clogged with oil and dead skin cells, milia form when keratin gets trapped under the skin with no pore leading to the skin's surface. Now, what causes this keratin to get trapped? Factors could range from skin damage due to sunburn or blistering to long-term use of steroid creams. Even some skincare and beauty products that aren't suitable for your skin type could lead to milia. On the other hand, whiteheads are a type of acne that forms when dead skin cells, oil and bacteria become trapped within one of your pores. Whiteheads are also known as closed comedones because the pore is blocked entirely, creating a small white bump on the skin's surface. Common culprits behind whiteheads include hormonal changes, certain medications, and yes, even stress. Using heavy, oily skincare products or makeup can also lead to whiteheads by clogging your pores. Now, you might be thinking, can I just pop these and be done with it? But hold on to that thought. While it might be tempting to try and get rid of milia and whiteheads by squeezing them, this is a big no-no. Why? Because popping them can lead to skin damage and even infection. Instead, adopt a consistent skincare routine. For milia, exfoliation can help. It removes the top layer of dead skin cells and can prevent keratin from getting trapped. Retinol creams can also be beneficial as they speed up cell turnover and prevent dead skin cells from clogging pores. For whiteheads, a skincare routine that includes a gentle cleanser, a non-comedogenic moisturizer, and a salicylic acid or benzoyl peroxide treatment can be effective. Salicylic acid works by penetrating and dissolving the type of skin debris that clogs pores, while benzoyl peroxide kills acne-causing bacteria. However, if you're dealing with persistent milia or whiteheads, it's best to seek the help of a dermatologist. They can provide treatments such as prescription creams, chemical peels, or even manual extraction to safely and effectively deal with these bothersome skin issues. While milia and whiteheads may seem hard to get rid of, with patience and the right skincare routine, you can keep your skin clear and healthy. Now that we've covered the causes and treatments of these 4 types of acne, let's take a quick recap. We began our journey into the world of acne by exploring its various types. We discovered that acne isn't a one-size-fits-all condition, but rather a spectrum of blemishes that can occur on the skin. Whether it's cystic acne, blackheads, milia, or whiteheads, each has its own unique characteristics and treatment methods. Delving into cystic acne, we learned that it's one of the most severe forms of acne, resulting from a combination of bacteria, oil, and dead skin cells that clog the skin's pores. We highlighted that this type of acne requires a more comprehensive treatment approach, which may include over-the-counter products, prescription medication, or even professional procedures. Moving on to blackheads, we clarified that these tiny dark spots are the result of open pores that have become clogged with excess oil and dead skin cells. The color change happens when the oil and skin cells oxidize and turn dark. Topical treatments, such as salicylic acid and retinoids, can be effective in managing blackheads. Our exploration then led us to milia and whiteheads. We explained that milia are small, hard white bumps that occur when keratin, a protein in the skin, gets trapped under the surface. On the other hand, whiteheads are closed comedones formed when a pore gets clogged with oil and dead skin cells. Both of these can be addressed with exfoliation and retinoid creams. As we've journeyed through these different types of acne, the key takeaway is that understanding the particular type of acne you're dealing with can significantly influence the treatment approach. Each type requires a different strategy, and what works for one may not work for the other. Remember, understanding your acne is the first step towards managing it. So, keep these points in mind and you'll be on your way to clearer,